Hi there. Now in this video, we will be talking about the aerobic exercise prescription and also some of the principles to guide you in planning exercises for patients. Okay, let's get started then. Now, a very useful and often used principle for planning and progressing an exercise program for patients is using the FITT principles. Now, FIT stands for frequency, intensity, time, and type. Now we'll talk about these principles in this particular video. However, I may not refer to them directly as FITT. If they do occur within a content, I'll try to denote them in brackets on the slide so that you know that the content is related to that particular principle. As mentioned in my introduction to aerobic exercise videos, the range of health is a continuum. And this can be viewed also as a continuum that fits with the intensity or dosage of our prescribed exercises. As the dosage of the exercise or physical activity increases, it pushes the person along the continuum towards the fitness end. You should also bear in mind that physical activity and exercise intensity should be individualized to the particular person. If we over or under prescribe the exercise dosage, then the person may suffer or not benefit from our intervention respectively. So, if we are individualizing the intensity to the person's specific circumstances, what are some of the things that we can use to help us do this? Two useful outcomes that we can use for this are 1. The heart rate, and 2. The ratings of perceived exertion. If we are using heart rate as the outcome for prescribing the intensity of the exercise, the most common outcome we can use is the maximum heart rate, or heart rate max. The maximum heart rate is the maximum number of heartbeats in 1 minute of effort. There are several guidelines we can use heart rate max to help us with this task. For unfit people, we could start with a lower intensity exercise, as we do, and therefore perhaps use about maybe 55 to 65% of the heart rate max for the exercise itself. That is, the person should sustain the exercise at his or her heart rate max for a specified amount of time. For people who are older, frailer, and with very low levels of fitness, we can use about between 35 to 55% of the heart rate max. This means an even lower exercise intensity than for unfit people. Now, for people with higher fitness level, we can obviously increase their intensity, and we may consider using about between 70 to 90% of their heart rate max. You might be thinking, well, heart rate max sounds rather useful. So how do we then calculate it to help us with our exercise prescription then? There are various methods of doing it, but the simplest way to do this is to simply take a person's age and minus it from 220. Now, it is very important to bear in mind that this is a very rough estimate and is applicable to the general population only. This should be adjusted as appropriately if a person has got varying fitness levels. Now, let's relate this to the worldwide general recommended amount of physical activity that we should be doing in order to maintain health. So the ACSM, the WHO, and most public health authorities in different countries recommend that we should participate in a minimum of 150 minutes of moderate or 75 minutes of vigorous aerobic physical activity per week. And these physical activities should be performed at a sustained level of a raised heart rate of about 70 to 90% of a heart rate max. And as you can see, this is where the heart rate max is useful in helping us achieve the beneficial effects of physical activity. Besides heart rate max, another useful indicator of exercise intensity is the rating of perceived exertion, or RPE for short. If a person has a depressed heart rate response, for example, people on beta blocker medication, which causes the heart to beat slower, then a heart rate max is a fairly inaccurate measure, and we may actually overwork the patient by prescribing exercises that are too intense for the patients. So this is where the RPE is useful to determine intensity. Now, the RPE is usually measured by the Borg scale. The reason why it's called a Borg scale is because it was created by Gunnar Borg, a psychometrician. And there are two versions of the Borg scale for the RPE, the category scale and the revised category ratio scale. It is important to bear in mind that this is a subjective scale. That is, it depends on the person reporting their perceived exertion. Due to the robust psychometric testing that went into developing these scales, so long as they are used correctly, they can actually be quite a good estimate of exertion and intensity of physical activity. It is simple to use, and the person is asked to rate their physical exertion of the scale according to their overall feeling of physical stress and fatigue. They should not take into account any factors such as leg pain or breathlessness. So this is, you're asking the person to use it to grade their overall exertion and fatigue. When a person is at rest, this is denoted as 6 on the category scale and 0 on the category ratio scale. So these are two separate scales and you can use either one of them. Now, to help the user determine the exertion level, beside the scale are exertion descriptors. For the category scale, there is a relationship between the number, rating, and the heart rate in an average person. So what you do is you simply add a 0 behind the number and you get a very rough estimate of the heart rate of the person at that moment. For example, if during a gentle exercise, the person rated their RPE as 9 on the category scale, it can be estimated their heart rate is at roughly about 90 beats per minute. And of course, this is obviously only an estimation. Now, this can only be done for the category scale and not for the category ratio scale. We can also look at the RPE in relation to the heart rate max of a person. We can estimate that an RPE rating of below 10 should indicate to us that the person is currently exercising at below 35% of their heart rate max. And if they rate their RPE as between 12 to 13, then they can be achieving roughly about 55 to 69% of their heart rate max. It is important to remember that the duration and intensity of the exercise is inversely related when calculating an energy expenditure of the exercise. What this means is that if we increase the intensity of the exercise, then the duration can be reduced to achieve a target energy expenditure. So, how does this translate to practical use when we design exercises for people? One simple guide is that we are prescribing moderate intensity exercises. We should aim to have the exercise duration to be longer. Being healthcare professionals, we should always ensure that the safety aspects of anything we do has been considered. In this case, if we prescribed high intensity exercise, we should be aware of the increased risks associated with it. For example, greater cardiovascular injury risk, higher risks of joint, muscle, and tissue injuries, and also, if a person feels that it is too hard, they will also not persevere with the exercise, which defeats the original purpose of the exercise. So if we are to prescribe exercises and physical activity to people, how long should we prescribe it for? So in line with the WHO physical activity guidelines, duration of between 20 to 60 minutes per day is a good idea. And this can be broken down into smaller chunks if it can't be done at one go. Now that we know how long each exercise bout should happen, the next thing to do is to find out how often should the person be doing the exercises or physical activities. Again, using the WHO guidelines, the person can do this about 3 to 5 times a week at moderate or high intensity so as to achieve the 150 minutes moderate or 75 minutes of vigorous activity. Of course, if they can do more, all the better. But do bear in mind that any improvements tends to plateau at about 3 days per week. And we should also advise the person that adequate rest is maintained between sessions to reduce the risk of injuries. For the aerobic exercises we are talking about here, it should involve large muscle groups so that the activity is intense enough to generate the cardiovascular benefits we are looking for. To help with the adherence of activities, the type of activity should be enjoyable. For ease of participation, it should not require too much training or skill so that the person can do it almost immediately. Of course, if a person wants the challenge of an activity that requires more skill, it is possible as well. If a person engages faithfully with the prescribed activity, he or she will discover very quickly that although they are doing the same activity at the same intensity and duration, the activity starts to become easier. So this is good, as this means that the person is improving, and we should now start thinking about progressing the person's activity. To progress the person's activity and to challenge the person's body to increase its fitness, we can again use the FITT principles to progress the activity. So we can increase the frequency of the activity, we can also increase the intensity of the activity, we can increase the time or duration of the activity, or we can change the type of activity that a person engages in. Other things to think about are the duration of recovery time. So make it shorter so that it stresses the body even more. Add more exercises to make the session more intense and longer, and also possibly more interesting. How about increasing the difficulty of the activity itself? Well, these are just some suggestions that you can use to modify and progress exercises. So be creative. When we progress our patients, it is very tempting to achieve too much in a short period of time. The progression should be gradual for various reasons. 1. To prevent overuse injuries. 2. To encourage more adherence to the exercises. 3. Prevent unnecessary tiredness that may be excessive. And lastly, to reduce the perception of physical strain. So always monitor your patients to ensure that any progression you introduce is appropriate. Very often, we will encounter patients who have stopped exercising and come back to us with further issues. In this case, you should be careful to make sure that the dosage of exercise is appropriate to their current condition. The reason being that after a certain amount of time away from training or exercise, they will be deconditioned again. Interestingly, if one stops training, the effects gained doesn't quite go away immediately. If a minimal level of training is still maintained, it is possible to actually retain the training effect for up to about 15 weeks. Sometimes, you may want to modify the exercise program to individualize it to the person. For example, some situations where the exercise program needs to be modified or stopped are as follows: illness, excessive fatigue, and hot weather. Planning and providing the exercise program is the easy part, but getting the person to adhere and stick with the exercise is the hard part. There are multiple reasons why a person may not adhere to an exercise program, and here are some of the reasons. Here are more reasons why people may not adhere to the exercise program. The main thing is that we can actually identify which other factors are important to the person in order that we might be able to create the correct conditions to encourage the persons to stick with the exercise programs. Well, I hope you have found this video helpful in your understanding and application of the FIT principles and other principles for prescribing an exercise program. So this is Chee-Wee here, and I'll see you in my next video.